Instructions on the correct way to prepare and use an injection pen. Let's start by loading the cartridge into the pen. First, wash your hands with soap and water. Begin by removing the cap of the pen and then unscrew the cartridge holder. Now, slide the cartridge into the cartridge holder. Press in lightly at the back of the cartridge to ensure a snug fit. Push the cartridge holder and the pen straight together and screw back the cartridge holder onto the pen. The next step is to prepare your pen with a new needle. Take a new needle and tear off the protective paper tab. Push the needle straight onto the pen. Screw it on until it's tight. Pull off the outer needle cap and then pull off the inner needle cap. Sometimes a drop of medicine may appear at the needle tip. This is normal, but you must still check the medicine flow if you use a new pen for the first time. Never use a bent or damaged needle. Check the medicine flow before the first injection with each new pen only. Turn the dose selector until the dose counter shows 15. Press and hold the dose button in until the dose counter shows 0. The 0 must line up with the dose pointer. Continue until the pen plunger pushes up against the back of the cartridge. Now, we will gently test the flow by turning the dose selector until the dose counter shows 2. A drop of medicine will appear at the needle tip. If no drop appears, repeat up to 6 times. If there is still no drop, change the needle and repeat one more time. Do not use the pen if a drop of medicine still does not appear. Always make sure that a drop appears at the needle tip before you use a new pen for the first time. Now you will select your dose to be injected. Let's say you need to inject 0.25 milligrams today. Turn the dose selector until the dose counter stops and shows 15. 15 is equal to 0.25 milligrams. 30 is equal to 0.5 milligrams. 60 would then be equal to 1 milligram. Do not push the injection button while turning, as the medicine will come out. You cannot turn the dose knob past the number of units left in the pen. Do not force the dosage selector to turn. Choose your injection site and wipe the skin with an alcohol swab. Let the injection site dry before you inject your dose. Insert the needle into your skin as your healthcare provider has shown you. The preferred site for administering is on the lower abdomen, except for the 2 centimeters around the navel area. Make sure you can see the dose counter. Do not cover it with your fingers, as this could stop the injection. Deliver the dose by slowly pressing the injection button in all the way. The number in the dose window will return to 0 as you inject. The dose knob will turn and you will hear clicks as you press down. Keep the injection button pressed all the way in and slowly count to 10 before you withdraw the needle from the skin. This ensures that the full dose will be delivered. Put the needle cap back on the needle. Unscrew the needle from the pen and dispose safely. Put the cap back on the pen, then store the pen in the refrigerator until your next injection.